All right. I am just getting my system set up here to start this master class on PCOS. I'll start in just a couple of minutes. Go. Start right on time at 5:45. Okay, Jan, I think I got you set up. My office manager will be on so that she can direct questions to me. All right. All right. We are ready to roll. So, I can hear right now my daughter and my husband playing out in the living room, and this really wasn't a part of my presentation on PCOS, but I think it's kind of a perfect way to introduce this topic. So, PCOS stands for polycystic ovary syndrome. It affects about 10% of women, although research suggests that a lot more women are affected by PCOS than are actually diagnosed for it. And we're going to talk quite a lot today about why that is. Here's what I've got for you tonight for polycystic ovary syndrome. This is a masterclass on the topic. I chose the word masterclass because I'm going to be diving deep into not only what PCOS is, but I'm also going to be talking about what the health risks are associated with PCOS, which frequently, when women are diagnosed with PCOS, they are not informed about what the health risks are. And it's not because their doctor doesn't care. It really is a subject of women's health that is not well understood. And there is quite a lot of research out there on PCOS. But a lot of practitioners do not specialize it and don't understand it very well. I was diagnosed with polycystic ovary syndrome when I was 29 years old. I was experiencing the symptoms of PCOS for about 10 years prior to that. PCOS can be an incredibly difficult condition to get diagnosed with. And part of what I'm going to talk about tonight is how to empower yourself for getting that diagnosis and what you need to ask for specifically in order to get the test that you need to determine if you are actually suffering with PCOS. We're also going to be talking in tonight's workshop about how to reverse PCOS. I technically no longer have PCOS. My testosterone levels are normal. I no longer have cysts around my ovaries. I get my period every month. When I was diagnosed with PCOS, I was told that I would never have children. I was told that I would need to go on metformin, which is a diabetes medication, as well as birth control. I was told that the array of symptoms that I was dealing with at that point, including chronic pain, depression. I was not getting my period at all. Weight gain, facial hair, acne, high lipid levels, high and imbalanced cholesterol levels. The list is long. And if you have PCOS, or if some of what I share tonight sounds like what you're struggling with, I have so many tips for you in how you can change the way that you take care of yourself and really reverse this diagnosis for yourself. So, as I mentioned at the start of this master class, I can hear my daughter and my husband playing out in the living room, which is a really lovely way for us to start this workshop, because I was told that I would never have children, that it would not be possible for me unless I did IVF. And even in that scenario, I may still not be able to have a child. And I did. So let's talk about how I did that. And let's also talk about how I was able to reverse my diagnosis. And really, PCOS is what brought me to my nutritional therapy practice in the first place. I now work full time with people who struggle with an array of different hormonal imbalances. And PCOS is quickly becoming one of my specialties. So there's nothing like having experienced something yourself to be able to help other people with as well. I'm so passionate about PCOS for a lot of different reasons. The first reason is that the symptoms of PCOS can be incredibly debilitating, but also the health risks associated with PCOS are rather daunting. And so I want to go through what those health risks are in the event that you are not aware of them. But please know that when I'm done talking about these health risks, what I'm going to transition directly into is the mindset that you need to take on in order to meet the challenge that PCOS presents you with. Okay, when you start to hear the statistics around PCOS and what some of the health conditions are associated with it, the statistics are daunting. I am not gonna BS you about that one. Okay, they are daunting. However, there is so much that you can do to not only relieve the majority, if not all, of the symptoms of PCOS, but it is also entirely within your control to not be one of the statistics that I'm going to be talking about in tonight's workshop. Okay. And then at the end of the workshop, we're going to be talking about all of the techniques that you need to put into play in order to start feeling better today. Okay. So please hear me when I tell you that it is possible for you to lose weight when you have PCOS. It is possible for you to balance your blood sugar when you have PCOS. It is possible for you to clear up your skin when you have PCOS. It is possible for you to have a baby when you have PCOS. It is possible for you to start having a period again when you have PCOS. Okay. Be careful about how you perceive a diagnosis like PCOS. And I talk to my clients about this all the time, whether you've been diagnosed with an autoimmune disease, whether you've been diagnosed with diabetes. Pay attention to what your brain does immediately. Okay, what the brain will do is tell you, oh, this is written in concrete, right? I can't do anything to change this diagnosis. Okay? And what I want you to hear tonight, and one of the big takeaways that I want you to have, is that it is possible to change the trajectory of your health and dramatically improve the way that you feel. I have done it with myself, and I do that every single day with the clients that I work with. All right, so what is PCOS? PCOS stands for polycystic ovary syndrome. Essentially, what happens in PCOS and kind of the classic presentation are high testosterone levels and cysts around the ovaries. As I mentioned earlier, getting diagnosed with PCOS can be an incredibly challenging thing to do in the first place. Okay, as I said, I was struggling with the symptoms of PCOS for 10 years before I got diagnosed. And actually, it was longer than that. I was just a teenager and didn't even realize how far things had gone off the rails. But by the time I was 19, 20, I realized that what was going on was not normal. Okay, but it can take a really long time to get diagnosed. So what you need to get diagnosed with PCOS is two parts. You need an ultrasound of your ovaries to determine if you have cysts on your ovaries. And then you also need to get a hormone panel done, specifically looking at your testosterone levels. Okay. Once a physician has those two pieces in play, they can then diagnose you and help you to understand what's going on with PCOS. Now, again, what a lot of women are not informed about when they are diagnosed with PCOS is that there is an immense amount that you can do to help yourself and even reverse your diagnosis. B, they're not informed about the health implications of PCOS. And C, they don't understand that there are different phenotypes of PCOS. So PCOS can present in a lot of different ways, which we're going to talk about tonight. So PCOS affects, first and foremost, usually for women, ovulation and menstruation. It's very common for women who have PCOS to not be ovulating, and frequently they don't get their period. Okay, there are different phenotypes that can present different ways. Some women who have PCOS get their period, okay, but they still have cysts around their ovaries. Other women don't get their period, have cysts, have high testosterone levels, right? So there's different degrees of what can be going on. The international percentage or average, if you will, of women who have PCOS is between 10 to 13%. However, the National Institute of Health has determined that that percentage is likely quite a bit higher, and that actually about 70% of women who actually do have PCOS don't realize that they even have it in the first place. Which, when we start to dig into what's involved with PCOS, you'll quickly understand why it's a real problem that many women in the world actually are not aware of the fact that they have PCOS in the first place. One of the biggest considerations with PCOS is weight gain. Okay, I work with a lot of women who are struggling to lose weight, and I'm going to be touching on some of the research on weight loss that is rather striking. And the first thing that I want to tell you is that this societal conversation that weight loss is all about calories in, calories out, that is not an accurate representation of how a person actually loses weight. And specifically with PCOS, if you don't understand the driving factors behind PCOS, you will not be able to lose weight. And it is estimated that about 80% of women who have PCOS are obese. I'm going to say that again because it is such a shocking statistic. 80% of women who have PCOS are considered obese. Okay, and I will tell you right now that I weigh a very normal amount. I'm a size 6. Okay, so again, when I tell you that it is possible to reverse the symptoms of PCOS, I know that because I've done it and I've seen my clients do it as well. Okay, so we've talked about high testosterone levels. We've talked about weight gain. We've talked about cysts around the ovaries. Talked about irregular periods. We have not talked about blood sugar. Okay, and that's a very, very important part of PCOS. And again, this is an area of PCOS care that women are rarely, if ever, informed about. The testosterone levels, the high testosterone levels that drive a lot of the symptoms associated with PCOS actually happen because of blood sugar imbalances. So here is an absolutely wild statistic for you. that about 50 to 70% of women who have PCOS will develop type 2 diabetes by the time that they are 40 years old. Okay? That is a shocking statistic. And again, I will tell you that when I was diagnosed with PCOS and continued to try to deal with at times the debilitating symptoms of PCOS, I had no idea that blood sugar irregularities were driving my symptoms. Okay, so we're going to be talking about today, A, how to figure out if your blood sugar is imbalanced, and B, what to do about it, because there is so much that you can do about that. Cardiovascular disease. So women who have PCOS are at a twofold increased likelihood of developing cardiovascular disease. Again, that is an incredible statistic. So, as I mentioned earlier on in this workshop, when I was first diagnosed with PCOS, my cholesterol levels were quite imbalanced and at an unhealthy level, even though at the time my diet for all intensive purposes was beautiful. Okay, so it didn't make any sense. I want to focus on this topic for a moment. So we know statistically that women who have PCOS are more likely to develop cardiovascular issues. However, what does that mean? Okay, so PCOS is driven by blood sugar imbalances, which is also married, if you will, to inflammation. Inflammation is a real driver of cardiovascular disease. Okay, so here again, we want to start to understand how to determine if blood sugar issues are an issue, but also how to determine if inflammation is an issue for you. And if it is, how do you deal with that? Okay, we're going to be talking tonight about what tests you need, what supplements you need, what kind of dietary changes you need to be making in order to deal with these very real health concerns. Endometrial cancer. So women who have PCOS are 2.7 times more likely to develop endometrial cancer, and that's according to the Lancet Oncology. Why is this? Because a lot of women who have PCOS are not ovulating and they're not menstruating. And that lining becomes both of the uterus, but also the functionality of the ovaries becomes quite inflamed. Depression and anxiety. I really want to highlight this symptom of PCOS. Mental health is so incredibly important for everything that we do in our lives. Both our physical and our mental health really does determine our ability to show up in the world and be our best for our family, be our best for the people that we love, do our best work, right? And arguably most importantly, be the best that we can for ourselves. Why PCOS can drive depression, anxiety is still not entirely understood, but the hypothesis is that it is driven first and foremost by the hormonal imbalances associated with PCOS, but also that just the ongoing struggle of dealing with the symptoms of PCOS can cause that anxiety and depression to develop as well. Okay, and basically when you're dealing with obesity, when you have facial hair, okay, when you're not getting your period, which can sometimes result in feeling like you just have PMS all month long, okay, when you're suffering from chronic pain, those kinds of symptoms add up and they can take a real toll on your mental health. Sleep apnea, this is a statistic that even less people are aware of. So women who have PCOS are a 30-time increased risk of having sleep apnea. Okay, this is oftentimes associated with obesity and even just a 5% loss in body weight can help to bring the likelihood of developing sleep apnea down. Non-alcoholic fatty liver disease. So about 50% of women with PCOS show signs of non-alcoholic fatty liver disease. Again, that is a shocking statistic. We're going to be talking a little bit tonight about how important liver health is to blood sugar balance and to hormone balance. Okay, this is frequently entirely overlooked in the overall care of women who have PCOS. There are very strategic ways to regularly check on liver health that I will talk about tonight. And then there's so much that can and should be done to regularly support liver function. Let's talk about some of the kind of classic treatment options that are offered to women who have PCOS. So the first is birth control. The second is metformin, which is a diabetes medication. And then the third for women who are trying to get pregnant is IVF. Right? The problem that I have with all three of these options is that they don't actually address at a core level what is driving PCOS fundamentally. Okay? So while you can put a woman on birth control, that is certainly not going to change whether or not she is obese. That is certainly not going to help her get pregnant. That is not going necessarily to help her mental health. Okay, and it is not going to address the blood sugar and inflammatory conditions that are actually driving the PCOS condition in the first place. Later on in tonight's masterclass, I am going to be touching on specifically some herbs and supplements that have been researched extensively to work as effectively as metformin, that diabetes medication. Okay, they're seeing tremendous results with that. And I encourage you to do your own research. If you have PCOS, please do not take my word for it. Okay, dig into the research, start to educate yourself about this. Taking responsibility for your health is a really, really important step in feeling better. All right, I've mentioned that there are different phenotypes of PCOS. I want to go through what those are briefly, but I also want to just highlight the fact that irregardless of what phenotype of PCOS you have, it doesn't necessarily change the healing approach. So there's what's known as classic PCOS. Basically, with classic PCOS, you've got the full platter, if you will, of PCOS symptoms, which was me. Okay. Irregular or non-existent periods, high androgen levels or high testosterone levels, same word there, androgen and testosterone, and polycystic ovaries. Right. Again, basically in that ultrasound, what the ovaries look like is they just have a bunch of bubbles around them. And this is considered the most severe type of PCOS. Then there's ovulatory PCOS, which is where a woman has regular periods, but she's not actually ovulating oftentimes, and she has high androgen levels. Okay. Non-androgenic PCOS, irregular periods, polycystic ovaries, but they don't have high androgen levels. Okay, so when we were talking about how you get diagnosed with PCOS, just pay attention to this, right? That you may be one of those women who has polycystic ovaries, but you don't have high testosterone levels. You still have PCOS, right? And sometimes you are going to have to advocate for yourself with your physician in order to really get to the bottom of this. And you may end up having to educate your physician on the different phenotypes of PCOS so that they understand that as well. Then there's quote unquote what's called mild PCOS, which is irregular periods and elevated testosterone levels. I see this quite frequently in my practice. This is a good place to catch your PCOS developing. Okay, if we can catch it at this sort of quote unquote mild season that it's in, a lot of times women will not go on to develop some of the more disabling symptoms of PCOS. Okay, let's pause for a second. So I just threw so much information at you, so many statistics. Again, so many of the statistics that I shared with you tonight can feel incredibly overwhelming. Okay. So I want to talk about the mindset that is so important to develop when you have PCOS, or for that matter, any other condition or disease. I am a firm believer that regardless of what Google says about your diagnosis, that you have agency over your own life and you have agency over your health. And there are many, many, many things that are within your control. So first and foremost, catch yourself if you start going down that rabbit hole of hopelessness and feeling like all is lost, that you should just sit down with your ice cream and your Doritos and watch Netflix for the rest of your life, which God knows that sounds like a lot of fun until it's not anymore and you don't feel very good. Okay. So, developing a relationship with your mind, with yourself, catching yourself when you tell yourself things that are not particularly helpful and are not going to help you reach your end goal. Very important to focus on the journey and not the destination. I tell this so often to my clients who are struggling to lose weight. We all lose weight at different rates. And again, we're going to get into some of the research on weight loss. But what's telling about weight loss is that it happens at different rates for different people. There are different factors at play that can contribute to how people lose weight, including genetics. So if your sole focus is on how much weight you're losing when you're trying to stabilize your PCOS symptoms, you're going to entirely miss the whole point. Okay. When you're thinking about your PCOS, think about it from all of the different perspectives that it's coming from, how it's affecting your life in all sorts of different ways. Even if the scale does not reflect all of the hard work that you're doing, is your energy better? Are you sleeping better? Do you notice that your mood is a little bit more balanced? Maybe your blood work looks improved. Okay. And it takes up to 3 months to see any kind of improvement on blood work. Okay. So this is a lifelong journey. If you're really focused on that end destination, you are never going to get there. And I know that's tough to hear. It's a little bit of hard love there, tough love. But that is the truth of it. So really reframe your expectations and understand that this is a lifelong journey and really a lifelong commitment. Another very unpopular reality of having PCOS, or again, having another condition like an autoimmune disease. The truth is that you have to work harder than other people to take care of yourself. You just do. That's the truth of it. Okay. You have to show up for yourself at a level that other people do not have to. Okay. When I say other people, I mean people who don't have health issues. Right. Other people are not going to understand, okay, why you have to make the accommodations that you do for yourself. Okay? What matters is that you know. What matters is that you know that what you are doing is helping you. Okay, that's all that matters. It doesn't matter what other people have to say. They don't get to live in your body. All right, so let's switch gears here, and I'm going to start talking about specifics in my practice. So I'm going to take you step by step through what I do with my clients who have PCOS. Okay. We talked earlier about how PCOS is very much driven by inflammation and blood sugar imbalances. Working on gut health is foundational to balancing hormones. That is a main tenet of my practice. So one of the first things that I do with all of my clients is recommend that we run a GI map stool test, which it basically gives us a full outline of the gut microbiome. It's important to note here that about 70 to 80% of the immune system actually resides and lives within the gut. So when we're looking at PCOS as being a condition that's driven by inflammation, gut health is really a no-brainer here. We need to help the gut function better, heal those imbalances to help reduce that inflammatory load. A CGM is a continuous glucose monitor. This is one of the most exciting technological advances, if you ask me. I started using CGMs in my practice a couple of years ago, and oh my gosh, what an incredible game changer. You can attach this thing to your arm. There's an app that gets hooked up on your phone, and you can watch your glucose levels all day long. So for women who have PCOS, this is so important. What we need to figure out is what your capacity is for carbohydrates. All right. So let's do just a brief physiology tutorial here so that you can understand why this is so important. So SHBG, there will not be a test on this later, is the protein carrier for testosterone. Okay. When SHBG levels start to go up, testosterone levels go down. Okay. Insulin, when it starts to go up, it makes SHBG go down. What does this all mean? Insulin is the carrier for sugars in your blood. When you eat a donut, insulin levels go down. When you eat a piece of meat, when you eat a donut, insulin levels go up. When you eat a piece of meat, insulin levels go down. Okay. So if you're eating a diet really high in carbohydrates, your insulin levels are going to start to track higher and higher and higher. And simultaneously, what we know about women who suffer from PCOS is that the higher their insulin levels, the lower their SHBG, and the higher their testosterone levels are. So one of the foundational things that we can do to help women who have PCOS is get their insulin levels down and get their blood sugar balanced. I've done entire workshops on this very topic alone of how impactful blood sugar is on inflammation, on mood, on weight gain. The list goes on. Okay. But everybody's blood sugar levels are different. Everybody's blood sugar patterns are different. And one of the best ways to understand your unique blood sugar presentation is with a CGM. And again, I've given hour-long presentations on this, so it's just like a brief review. Hormone panel. This is a topic I feel quite passionately about, so bear with me here. Usually when women get their hormones tested, it's with a blood panel. The hormone panels that I use in my practice are saliva, and the ones that the hormone panels that I run for my female clients who are still of the age that they should still be getting their period, I run an actually a month-long hormone panel on them. Okay, so the reason for this is because generally women, when they get a blood draw hormone test, their doctors are usually only testing their hormones once, maybe twice in some instances, and you miss a tremendous amount of information. I just had a client today I was working with who we went over her hormone panel, and it was striking the difference between looking at a month-long hormone panel compared to just looking at 1 day blood draw. Okay? Having that entire month of information really helps us to guide our protocols so that we are foundationally supporting the glands that are contributing to the hormonal imbalances that this particular client was having. Okay, and it's again the same with PCOS. Frequently, women who have PCOS actually tend to have low estrogen levels, low progesterone levels, low FSH, low LH, and high testosterone. I will tell you right now that makeup of those different hormone levels being out of whack like that will make a person feel miserable. And the amazing news is that we can fix that, and we can fix it in about 3 months. Blood panel. So I will oftentimes run a full blood panel for my clients, including markers in it that are often not included in a traditional blood panel. So especially for my PCOS clients, as I mentioned earlier, I want to have a full look at their liver and understand what's going on with their liver. Again, because non-alcoholic fatty liver disease is so prevalent in women who have PCOS, but also because liver function is foundational to hormone balance. We're also going to be looking at blood sugar numbers as well. The A1C marker, which you may be familiar with on your own blood work, is a really important marker. It looks at your blood sugar on an average of the last 3 months. So it gives us a lot of information. The fasting glucose marker that's frequently on blood panels is not that helpful because it's only looking at the last 24 hours of blood sugar levels. Other markers that we want to be looking at for a woman who has PCOS. We also need to be looking at her thyroid markers. Frequently, the thyroid is struggling when hormones are struggling, and this can oftentimes be entirely overlooked because there's just so much else going wrong, frankly. And lastly, we want to be looking at those inflammatory markers. So again, as I mentioned earlier, women with PCOS are at a much, much higher likelihood of developing cardiovascular disease. We need to get ahead of that way before that cardiovascular disease begins to affect a person's life. And there are so many ways that we can do that. So let's get into that. Let's get into what some of the tools are that are available to you. Again, gut healing. Gut healing is fundamental and foundational for women who have PCOS. I will also say that women who have PCOS frequently have more inflamed digestive systems. Okay, so women who have PCOS need to be a lot more careful about taking care of their gut than maybe somebody who doesn't have PCOS. Again, when we look statistically at how women with PCOS have much higher levels of inflammation, and then we simultaneously understand that gut health is a major driver of inflammation throughout the whole body, it becomes clear that gut health should be one of our main priorities. When we're talking about gut health, again, I use a GI map test in my practice so that I get a full breakdown of the gut microbiome. And then we go through and we address those markers. And then we always retest 3 months later to ensure that anything that has been imbalanced is either corrected or on its way towards dramatic improvement. Diet. Diet is an area of PCOS that women can have huge impact on very quickly. Right? Now, certainly, if your digestive function is really struggling, even if you're eating the most beautiful diet, you may not be able to get as much progress, if you will, with changing your diet. Okay, but over time, those dietary changes will really start to snowball and benefit you and really work in your favor. So in general, I recommend to women who have PCOS that they reduce their carbohydrate intake significantly and get the majority of their carbohydrates from vegetables. Second of all, focusing on protein. So most people do not eat enough protein in their day. There are a lot of reasons for why this is, and a lot of the reasons why people just intuitively don't want to eat as much protein is because they're not digesting it well. So if we can help to improve protein digestion, people then start to eat more protein. Okay? Protein is a really important player in liver function. So when you're eating ample amount of protein, your liver can function better, and thus it can help to detox hormones, which is really, really important for hormone balance. And then certainly protein is a key player in balancing blood sugar, which, as we've talked about, is a really important priority for PCOS. Fat consumption and fat digestion. So if you have impaired gallbladder function, if you've had your gallbladder removed, odds are you're not digesting your fat very well. Okay, so the GI map is a really nice tool for identifying whether or not you actually are digesting your fat. And from an inflammatory standpoint, fat digestion is so important. Fat is really the building blocks of how the body inflames and then counter-inflames. So if you aren't eating a really nice, well-rounded array of fats in your diet, you're not going to be able to deal with inflammation in a healthy way. So let's look at kind of like the ideal PCOS diet. All right. I am a huge fan of intermittent fasting for women who have PCOS, as long as you can sustain that. Okay, so here's where a continuous glucose monitor could be incredibly helpful for somebody who has PCOS. If you tend towards being hypoglycemic, in other words, you can't go long periods without eating, intermittent fasting may not be a great idea for you at first. We may need to work into that. Okay. But if you slowly and consistently transition your diet towards vegetables, meat, protein, and healthy fats like olive oil, ghee, hazelnut oil, please avoid soy oil. Please avoid canola. Please avoid trans fats. Those are all going to be inflammatory. I am a huge proponent of grass-fed butter. That's also a really nice fat. So this combination of foods is going to help us to meet a number of our priorities. So first and foremost, again, is it's going to help you to balance your blood sugar. We're reducing that carbohydrate intake significantly, and then you're increasing your vegetable intake significantly, which means that you're getting a much higher dose, if you will, of antioxidants, which are so important for dealing with inflammation. You're also increasing your protein consumption. Please avoid eating soy. If beans bother your digestive system, pay attention to that. Okay, you may need to cut those out. Okay? Diversify your diet as much as possible. Spend time researching recipes and really think about getting ahead of your meal planning. Can make a huge difference in how well you're able to stick to your diet. Okay. If it's 5:30 and you're starving to death and you have no plan for dinner, odds are that you might order a pizza, even though when you woke up that morning, you were gung-ho about your diet. So one thing that I always recommend to my clients is plan ahead. It makes a huge, huge difference. Supplements. So I rarely make blanket statements about supplements. I really like to look at my clients' test results before I recommend specific supplements. But there are some supplements that have been heavily researched in relationship to PCOS that I do want to touch on. So essential fatty acid supplementation is so helpful for anybody who struggles with inflammation. Again, as I mentioned earlier, the way that the body inflames and counter-inflames is with essential fatty acids. And most people, because they're eating a standard American diet, they're not really getting a nice wide array of essential fatty acids. Quercetin. So this is such a cool supplement, and it has been heavily researched. So what the research tells us is that it's improving ovulation disorders, It's relieving insulin resistance. It's reducing androgen levels, i.e. testosterone. It's lowering testosterone levels. It's regulating lipid metabolism, which in other words means it's helping to balance cholesterol levels. It's regulating gut microbiota, which again, we've talked about significantly in tonight's masterclass and how important that is. And it also improves vascular endothelial function, which in other words means it helps to improve the functionality of the cardiovascular system, which we know is hugely important for women who have PCOS. Berberine. So we've talked a lot tonight about not only how important it is to balance blood sugar when you have PCOS, but also that we really have some pretty significant and serious health considerations with PCOS. Okay, this statistic that 50% of women with PCOS will go on to develop type 2 diabetes by the time they're 40 is so shocking to me. Okay. Berberine has been studied extensively, and it's been shown to be as effective as metformin in helping to regulate blood sugar levels. Now, it's really important here to make note that taking a supplement is not going to cure your PCOS. Okay, so you can't go out and eat trash and take a supplement and think that everything is going to be fantastic, because it will not be. All right. You can't go and stay up until 2 a.m. in the morning and exhaust yourself and be up at 6 and expect that you're going to feel amazing and that your hormones are going to be happy with you. Okay. So please understand that as I go through these recommendations, that this is a circle, if you will, with a lot of different pieces of the pie, and all of those pieces need to be integrated into your daily routine. All right. When I mentioned earlier that women who have PCOS have to work a little bit harder at taking care of themselves than other people do, that's what I'm talking about. There are supplements specifically to help support estrogen levels. As I mentioned, a lot of women who have PCOS tend to have low estrogen levels. So there's a lot that we can do to bump those up over the course of 3 months. Some women have the opposite problem. They're producing too much estrogen. I will tell you that that's, in my practice at least, that's much more rare. But it does happen, especially as women start to go into perimenopause. And there are other supports that we can bring in to help the body detox estrogen. Progesterone is such an important factor here. And a lot of women with PCOS have extraordinarily low progesterone levels, which will impact their sleep, their mental health, their fertility. This is an area that we can have massive impact on. Hypothalamus pituitary adrenal axis. So basically, when we're looking at sex hormone production, we need to look up the chain and understand how the brain is impacting hormone production. This, I will tell you, is an area of women's hormones and men's hormones that is almost always overlooked. All right. And the hormone panel that I mentioned earlier in this master class that looks at women's hormones over the course of a month, that really helps us to identify what is going on with the adrenal glands specifically. The adrenals are in part responsible for producing responsible for producing our stress hormones. So a lot of times women who have PCOS have been under chronic stress for a long, long time. And it has had a significant impact on their adrenal glands' ability to not only produce stress hormones, but it then has a downstream effect on sex hormones like progesterone, especially. Okay, so we want to really, again, take a holistic look at this. We not only want to support adrenals sometimes supplementally, but we also want to make sure that you're getting a really full good night's sleep, that you are integrating stress relief into your life, that you have potentially a meditation practice or a way to calm your nervous system down on a daily basis. Those kinds of things can go such a long ways for people who have PCOS. I want to touch again on this diet piece. So, because obesity is such a problem for women who have PCOS, and because our society is so obsessed with calories in, calories out, I really want to kind of bust this myth, if you will. So, there was a very large study done by the Women's Health Initiative. It is the largest and arguably the most important nutrition study ever done. And what it showed and spelled out very clearly is that reducing your calories and increasing your exercise does not equate to weight loss. So there were 50,000 women involved in this study, and they separated the women into two groups. So one group of women lowered their calorie consumption and increased their exercise. The other group of women did not. They just continued about their lives as they normally would. And what they found when the study was completed was that neither group lost or gained a significant amount of weight. So I share this with you to say that if you are struggling to lose weight and you have PCOS, please stop trying to starve yourself and exercise yourself to death, because it's actually going to be counterproductive. You need to take a step back and understand what the driving factors are behind PCOS. And I do hope that this masterclass tonight has helped you to understand what that is. Frequently, what I find in my practice is that when we lower the inflammatory load for a person, they simultaneously shed those extra pounds, whether it's PCOS or they have an autoimmune disease, or they just don't feel well and they don't know why. They don't necessarily have any kind of condition. Okay. When we figure out why the body is inflamed and we deal with that, those pounds frequently come off. So this dovetails right into a conversation about exercise. If you have PCOS, you really, really need to take care of your energy levels. Don't let yourself get to a place where you get totally exhausted and burnt out. And ask me how I know. I'm still learning how to do this myself. Okay. Sometimes I find it's very helpful to give people a scale. So 0 is just so depleted that you just can't even get out of bed. And 10 is like rock and roll energy. You're ready to go out and run a marathon. Okay. So I would recommend to you that you do not let yourself get to a level 3 on that energy scale. And if you're at a 3 and you, for instance, are going to go run 5 miles, you got to really pay attention to how you feel after that, girlfriend. Okay. So does that run give you more energy? So on that energy scale, do you go up to like a 5? In which case, that is actually potentially a super useful thing for you to do when you're feeling depleted. But what I will tell you is that most women, especially women who have PCOS, will find that if they go for a run when they're already feeling super depleted, it will further deplete them. And you really want to be careful about that, because what will happen is that that will continue to wear out your adrenals. And as we've talked about tonight, adrenal health is really fundamental to balancing your hormones and dealing with that inflammatory response. Lastly, genetics. Genetics are a really important factor with PCOS. I just started bringing genetic testing into my practice, and it is fascinating, the correlation between genetics and PCOS. So specifically, some of these SNPs that contribute to inflammation and blood sugar handling issues. So, what some of the information that we can garner from these genetic panels also includes what kind of exercise is really ideal for you. Okay. So, if you are a runner, but you never lose weight from that, there actually might be a reason for that we can discover in your genetic panel. You may actually be more of a candidate for weight training, strength training. Okay. And that's actually written in your genetic code. And then in addition, if you are genetically more likely to develop inflammation, that is such powerful information for us to know that we can really address, again, from a multifaceted perspective, right? So I hope that tonight's masterclass was helpful for you. Please send me your questions if they come up, and I would love to share more with you all of the incredible resources that I use in my practice with my clients. Okay. So if you have PCOS, I hope that this masterclass has given you hope. I hope that you can take away some really concrete action items that you can start putting into play tonight, tomorrow. All right. And remember that educating yourself about PCOS is so fundamental to you getting better and really reclaiming your life. All right. Thanks for joining. See you later.